Standard theory for dental care. How to fill a root canal to the apical end. How to fill a root canal to the apical end. Contents. 1. Instruments used. 2. Root canal enlargement and shaping. 3. Root canal irrigation and disinfection. 4. Try-in of the master point. 5. In cases of undersize. 6. In cases of oversize. 7. Root canal filling. Reference. 1. Instruments used. As shown in the photo in the upper right, prepare 25G and 27G injection needles, syringes, and pipettes. Cut the tips of the injection needles flat. Use the 25G needle in thick root canals prepared with a file of size 60 or larger, and the 27G needle in narrow root canals prepared with a file of size 55 or smaller. Fill the pipette with sodium hypochlorite and the syringe with oxyfull for root canal irrigation. 2. Root canal enlargement and shaping. 1. Root canal enlargement and the formation of the apical sheet are performed with precision while continuously measuring the root canal length electrically, as shown in the photo on the right. Infected dentin on the root canal walls must be completely removed. To ensure complete removal of infected dentin from the root canal walls, root canal enlargement is continued until, upon removal of the file from the canal, no decayed material or infected dentin adheres to the file's grooves, and only clean, white dentin chips remain. Furthermore, it is generally accepted that using a file 2 sizes larger to enlarge the root canal allows for the complete removal of infected dentin. 2. Root canal enlargement and shaping. 2. As shown in the illustration on the right, the removal of infected dentin from the root canal walls and a curved root canal is prone to causing perforations at the locations indicated by the arrows, therefore, special care is required. Specifically, after a fine file has reached the apical region, the upper portion of the root canal should be sufficiently enlarged using the crown-down technique or a largomere before forming the apical sheet. Next, the apical sheet is formed. However, rotating the file at the apical region at this stage will cause perforation at the location indicated by the arrow in the illustration on the right. Therefore, file rotation should be minimized as much as possible, and the apical sheet should be formed primarily through filing maneuvers. If infected dentin remains on the root canal walls after the apical sheet is formed, use a pre-bent file 1 size smaller to remove the infected dentin by scraping it away through filing maneuvers. 2. Root canal enlargement and shaping. 3. Do not rotate stainless steel endodontic instruments in curved root canals. Do not use nickel titanium instruments. Reason: the photo on the upper right shows a stainless steel file that has undergone plastic deformation. The bent shape of this instrument is suitable for removing infected dentin in curved root canals. However, as shown in the illustration on the bottom right, rotating endodontic instruments in a curved root canal results in the removal of infected dentin only on the outer side of the canal red line, leaving infected dentin on the inner side blue line behind. Furthermore, when rotational movements are performed with elastic instruments such as those made of nickel titanium, infected dentin is again left behind on the inner side blue line, while only the outer side red line of the canal is removed. 3. Root canal irrigation and disinfection. As shown in the photo on the upper right, root canal irrigation involves injecting sodium hypochlorite into the root canal using a pipette and then inserting a file 1 size smaller to remove the smear layer from the root canal walls. Oxyfull is injected using a syringe to irrigate the canal all the way to the apical region. As shown in the photo on the lower right, using a surgical vacuum tip allows for thorough irrigation of the root canal with a large volume of oxyfull. By repeating this cleaning and disinfection of the root canal walls with sodium hypochlorite and oxyfull several times, the smear layer on the root canal walls can be completely removed. 4. Try-in of the master point. Cut a master point of the same diameter as the file used to form the apical sheet to the appropriate length for the root canal, and insert it into the canal. Take an X-ray with the master point trial fitted in the root canal. As shown in the 3 cases on the right, confirm that the master point has reached the apical region before proceeding with root canal obturation. 5. In cases of undersize. As shown in the two cases on the upper right, if the tip of the master point does not reach the root apex, the apical sheet is reformed and the root canal is irrigated. The preparation and irrigation are repeated as many times as necessary until the master point reaches the root apex. 6. In cases of oversize. As shown in the photo on the right, if the master point protrudes beyond the root apex, trim off the excess tip of the master point, try it again, and take an X-ray. After confirming that the tip of the master point aligns with the root apex, proceed with root canal filling. 7. Root canal filling. As shown in the photo on the right, root canal filling is performed by applying sealer to the tip of the master point and inserting the master point into the root canal. The filling is then completed by applying pressure as usual. That concludes this topic. Thank you for your attention.